Hello, and welcome to the Workplace Safety Training, addressing safe practices in clinical laboratory environment. Our focus in this module will be on exploring quality control processes within biochemistry. The topics covered in this module are sample for biochemical tests, pre-analytical stage, analytical stage, post-analytical stage, quality control, tips, and troubleshooting. In this section, we emphasize the criticality of sample management as mishandling can significantly impact biochemical analysis outcomes. Let's delve into the proper procedures for processing samples for biochemical tests. Biochemical tests utilize a variety of sample types including serum, plasma, whole blood, urine, and other body fluids such as cerebrospinal fluid, pleural fluid, etc. Key instructions for handling these samples will be outlined here. Collecting serum and plasma for biochemical tests. The process involves centrifuge the sample 10 minutes at 3000 rpm to separate the plasma and serum from the red blood cells, which may contain clot activators and separator gels, to efficiently separate serum. This step is pivotal for numerous biochemical tests, emphasizing the need for precise collection methods. For diagnostic evaluations, preparing plasma is critical, particularly for glucose and coagulation tests, which necessitated the use of specific anticoagulants during collection. Sodium fluoride in tubes halts glycolysis for glucose tests, and sodium citrate prevents clotting for coagulation tests, highlighting the necessity of filling tubes to their specified mark. Plasma collection specifics for diagnostic accuracy. Plasma for glucose determination. The use of plasma in glucose testing illustrates the critical role of sodium fluoride tubes in preserving glucose levels by preventing glycolysis. Plasma preparation for coagulation analysis. Coagulation tests necessitate the collection of blood in sodium citrate tubes, maintaining it in a fluid state optimal for coagulation assessments. Protocol for whole blood and blood gas specimens. Guidelines for whole blood sampling. Certain biochemical tests, including those assessing HbA1c, G6PD-H, and immunosuppressive medications such as cyclosporine tacrolimus, require whole blood. Using EDTA tubes is crucial to avoid clotting and maintain the integrity of these samples. Collecting arterial blood for gas analysis. The technique for blood gas and acid-base status testing involves arterial blood collection in heparin-prepared syringes, meticulously avoiding air to ensure the fidelity of gas measurements. Proper handling of urine and other biochemical fluids. Conducting timed urine tests. The accuracy of extended urine tests relies on the use of preservatives such as boric acid to safeguard the sample's stability and reliability over the collection period. Management of CSF and extracellular fluids. Prompt processing of CSF and fluids like acetic and peritoneal fluid is crucial. They should be gathered in sterile containers and, if not analyzed immediately, stored at 2 to 8 degrees Celsius. It's essential to discard samples that are hemolyzed, insufficient in volume, or improperly collected to prevent analytic complications. Pre-analytical stage. The pre-analytical phase of biochemical testing is susceptible to errors, mainly from human handling. It's essential to strictly follow the established procedures to ensure quality standards are met. Let's explore this topic further. Enhanced accuracy with barcode technology. Utilizing barcode technology for patient identification and sample leveling significantly minimizes errors often encountered with handwritten labels. This system ensures precise matching of patients to their samples, thereby reducing the likelihood of misidentification and potential diagnostic inaccuracies. Sample tracking and reporting. It's crucial to meticulously track the receipt of samples and the readiness of their corresponding reports. This systematic tracking aids in maintaining an organized workflow and ensures timely communication of results to healthcare providers. Verification of test requests. Before proceeding, it's essential to verify the request form against the test tube's labeling and the specific tests ordered. This step is vital to prevent any discrepancies that could lead to incorrect testing or misinterpretation of results. Assessment of sample volume. Evaluating the sample to ensure it meets the necessary volume requirements for the requested tests is critical. Insufficient sample volume may result in the need for recollection, delaying diagnosis and treatment. Sample quality examination. Observing the sample for signs of hemolysis or the presence of lipemic serum is crucial, as these conditions can affect the accuracy of test results. Consideration of patient factors. Taking a comprehensive history of the patient's food intake, alcohol consumption, drug use, smoking habits, stress levels, and sleep patterns is important. These factors can significantly influence test outcomes and should be considered when interpreting results. Pre-collection instructions. Providing patients with clear instructions for the collection of spatial samples, such as urine for a vanillin mandelic acid test, is essential for ensuring the accuracy and reliability of test results. Importance of proper containers and preservatives. The use of incorrect containers or preservatives can adversely affect the sample's integrity and consequently the test results. It's imperative to use the appropriate materials for sample collection and preservation. Critical nature of sample transportation. The transportation of samples to the laboratory is a critical step that can impact the viability and integrity of the sample, especially for tests sensitive to temperature or movement. Sample processing techniques. The processing of samples, such as the separation of serum via centrifugation, requires precise control of speed and temperature. Proper handling during this phase is vital for obtaining accurate and reliable test results. Analytical stage. During the analytical stage, the outcomes are greatly influenced by the quality of instruments and reagents used. Adhering to guidelines is essential for managing these factors effectively. Let's explore how this adherence can impact the accuracy and reliability of results. Maintaining instrumentation and reagent integrity. Routine maintenance. Implement a structured schedule for daily and monthly preventive maintenance for each piece of laboratory equipment. This practice is essential for the consistent operation and longevity of instruments. Monitoring essentials. Regularly monitor water quality, power supply, and calibration status of instruments to ensure optimal conditions for analysis. Reagent management. Log the dates when reagents and kits are received and opened to track their freshness and viability. Reagent validation. Test new lots of reagents alongside old ones in parallel to verify their consistency before they are used for analysis. Quality assurance. Conduct quality control checks to verify the accuracy of results produced by the instruments prior to sample processing. Standardization practices. Utilize primary standards, which are highly purified substances, to calibrate instruments. Employ secondary standards, which have concentrations determined by analysis and benchmarked against primary standards to ensure precision. Addressing errors in the analytical stage. Random errors. Identify and mitigate random errors which compromise precision and cause variability in repeated measurements. Systematic errors. Systematic errors are consistent issues that can cause results to be wrong, and they need to be addressed. These can be due to reagents or standards that aren't met correctly, affecting the outcome of tests. Instrumentation faults that can lead to incorrect measurements. Unclear procedures that may result in tests being performed incorrectly. Post-analytical stage. In the post-analytical stage, laboratory work culminates with the careful evaluation and release of test results. Although this stage has a lower incidence of errors compared to the pre-analytical phase, it's not without risks. Errors can arise from improper use of test results, the process of reporting critical results, and ensuring accurate transmission of these results. To mitigate these issues, the following guidelines are recommended. Result review and validation. Ensure that all test results are carefully examined and confirmed before their release. Critical result analysis. Gather all necessary clinical information and consider pre-analytical and analytical factors before interpreting critical results. Data accuracy. Cross-check all demographic and patient-specific data such as ID numbers and specimen types to maintain the integrity of test results. Sample storage post-analysis. Keep primary samples stored appropriately after testing to allow for any necessary retesting or additional analysis. Storage duration protocols. Define clear storage duration for biological samples tailored to their specific preservation needs. Temperature guidelines for samples. Follow strict storage temperatures like room temperature for a maximum of 4 hours in uncapped tubes or refrigerated condition for capped tubes. Laboratory Information System, in short LIS. Use an LIS to effectively manage, archive and retrieve results and laboratory information. Critical Results Notification. Quickly inform the relevant medical staff about critical results, maintaining a systematic feedback loop and documentation. Minimization of recollection. Avoid the unnecessary recollection of samples by ensuring precise and accurate testing procedures. Guidance seeking. Encourage staff to consult with seniors or management when in doubt, fostering a culture of communication and support. Quality control. Quality control ensures laboratory results are reliable, accurate, and precise. Accuracy is the agreement between a measurement and the true value, with deviations pointing to systematic errors. Precision reflects the consistency of measurements with one another, with variations indicating random errors, assessed by standard deviation and percent coefficient of variation. Quality control in biochemical testing. Quality control is critical for producing reliable biochemical test results. It encompasses the entire process from specimen collection to analysis, considering several factors that can impact the accuracy and precision of the results. Key factors influencing quality control are as follows. Time between collection and testing. Cells like leukocytes and RBCs consume glucose from the sample, reducing its concentration over time. Specimen storage. Improper storage conditions can lead to erroneous test outcomes. Evaporation effects. Sample evaporation can alter the concentration of electrolytes, leading to incorrect results. Light exposure. Bilirubin levels are sensitive to light, which can degrade the sample and affect readings. Temperature control. Refrigeration impacts enzymes such as lactate dehydrogenase, changing their activity levels. Clerical accuracy. Errors can happen at any stage of the process, so meticulous record keeping is essential. By carefully managing these aspects, the integrity of biochemical testing can be maintained, ensuring high-quality, dependable data for clinical decision-making. Objectives of quality control in laboratory testing. Precision and accuracy. Maintain a detailed record of test precision and verify accuracy against known standards. Trend monitoring and performance checks. Issue early alerts on control trends and evaluate automated analyzer consistency. Methodology and skills evaluation. Determine the most accurate testing methods and assess technologist expertise. Error detection and patient safety. Identify analytical errors promptly and ensure patient results are dependable. Benchmarking. Regularly benchmark test results against established standards for quality assurance. Criteria for quality control materials. Availability and stability. Must be available in ample quantity and maintain stability for at least 1 year. Volume and concentration. Provided in small volumes with consistently minimal concentration variance. Uniformity and testing protocol. Composition should remain consistent across vials, and materials should undergo the same testing as actual samples. Addressing quality control errors in the laboratory. Quality control errors in laboratories are categorized into random and systematic errors. Random errors are unpredictable fluctuations affecting test precision, while systematic errors are consistent biases that skew results. Addressing these errors is crucial for accurate laboratory testing. Random errors in laboratory quality control. In the pursuit of excellence in laboratory practices, understanding and mitigating quality control errors is fundamental. Random errors, characterized by their unpredictability and variability, can significantly affect the precision of test results. These errors can arise from a multitude of sources, ranging from equipment defects to environmental factors, and even through to the final stage of patient data handling. Acknowledging and addressing these errors are critical steps in enhancing the accuracy and reliability of laboratory data. Let's explore the impact of random errors in detail. Standard deviation impact. Random errors contribute to increased standard deviation. Equipment defects. Present in pipettes and glassware with manufacturing defects. Potential issues with instruments and spectrophotometers. Environmental influences, effects of light, temperature, and evaporation on samples. Sample interference, other substances may contaminate the sample. Clerical mistakes, mislabeling patient names or delays in sample transport, avoidable through trained staff, organizational efficiency, and result verification. Systematic errors in laboratory quality control. Systematic errors, in contrast to random errors, can introduce a consistent bias to laboratory results, necessitating thorough understanding and management to ensure diagnostic accuracy. Let's delve into the details of systematic errors. Mean value displacement. Systematic errors tend to shift the mean value consistently up or down. Reagent stability. Instability of reagents can contribute to systematic errors. Standard accuracy. Inaccuracy in standards can lead to systematic errors. Method specificity. The use of analysis methods that are not specific to the analytes being tested can lead to systematic errors. Critical techniques. Kinetic analysis considerations. Performing kinetic analysis at 340 nanometer is essential for precise quantification of certain analytes. Tips. Maintain a controlled environment with vigilant temperature monitoring and cleanliness to ensure accurate testing conditions. Consistent maintenance and thorough record keeping are essential for streamlined laboratory operations. Best practices for operating a biochemical autoanalyzer. With biochemical analyzers, diligent reagent management, waste system evaluations, and regular quality control checks are critical to ensure the device's reliability and the precision of test outcomes. Let's explore this in detail. Temperature control. Ensure room temperature is within the optimal range for analyzer operation. Routine maintenance. Conduct daily maintenance checks and maintain logs for weekly and monthly upkeep. Waste management. Regularly inspect the analyzer's waste disposal systems. Reagent management. Verify reagent levels for both loading and unloading procedures. Reagent stability. Keep track of the onboard stability of reagents within the analyzer. Quality control. Perform quality control and, if necessary, calibration to align with target values. Sample handling. Begin sample runs only after ensuring the analyzer is fully functional. Sample quality. Inspect sample quality before analysis. Reject hemolyzed samples and those with clots. Troubleshooting. Effective troubleshooting for biochemical analyzers. Understanding the basics. Familiarize yourself with the analyzer's principles and maintenance protocols for swift issue resolution. Modular approach. Break down the analyzer into key systems: optical, liquid distribution, and temperature control for targeted troubleshooting. Problem localization. Identify which system the issue lies in to quickly pinpoint the problem area. Common issues. Look for typical problems in the optical and distribution systems or DC power supply, with bulb aging being a frequent optical issue. Distribution system complexities. Be aware of potential issues like air leakage or blockage within the analyzer's intricate pipeline network. Water quality checks. Ensure the use of high-quality reverse osmosis water for the washing processes. Fault detection. Utilize built-in error reporting functions to facilitate faster problem identification and resolution. Hardware versus software. Assess instrument repeatability to determine if issues are hardware or software related. DC power supply vigilance. Monitor the output voltage purity and value as part of your initial equipment checks when an issue arises. Maintenance strategy. Adopt a structured approach to understand the equipment's function for efficient and rapid repairs. Now, let's revisit and reinforce certain key components covered in the previous lessons to recall and solidify our understanding, aiding in the retention of our learnings. Lab data quality control in a clinical laboratory encompasses rigorous procedures to ensure the accuracy and reliability of test results. It's critical for accurate diagnosis because precision data informs clinical decisions. Without it, Patient care could be compromised by incorrect treatment decisions based on faulty lab results. Quality control safeguards against errors, ensuring that clinicians can trust the lab data they use to diagnose and treat patients effectively. What leads to data inaccuracy in clinical laboratories? Various factors contribute to data inaccuracy in clinical laboratories, including instrumentation errors, human error, reagent issues, inadequate training, environmental factors, sample integrity, testing procedure errors, and quality control failures. In clinical laboratory practices, following quality control standards for biochemical studies is essential to maintain accurate and reliable results. It's crucial to integrate these guidelines into daily procedures to ensure excellence in lab operations. We'll come back soon with our upcoming sessions on workplace safety training series for safe practices in clinical laboratory environments. Stay tuned for valuable insights and practical tips to ensure a secure and productive work environment. Thank you.